Hello again. Sorry for that. I'm working out technical difficulties, as I guess everyone is during this special time. Thank you, everyone, for taking the time to come to our meeting today. We know that sometimes it's harder to remember the virtual meetings, especially these that are only happening once a month. So we definitely appreciate you being here. We kind of just want to start out like we usually do. And if you wouldn't care to go around, and we're just going to ask you to introduce yourself, um, tell us the agency or sector that you're representing. And if you could just tell us kind of how you got involved with our group, that would be great too, I think, since we have some new folks joining us.
I'll go first. Nobody wants to be the first to go. I'm Lisa Atkinson. I'm with United Way of Blount County. I started with Be Aware Blount back when it was SAPIT, and have a personal interest as well as a professional one. And so just kind of as working at United Way and being involved in a lot of programs where this impacts and touches, like to kind of stay in the loop as far as what's going on in the county to help address some of this.
Great, thanks.
I'll go. I'm Eric Landry. I'm the faith-based community coordinator for East Tennessee's Grand Division, which is 33 counties. Blount is one of my counties. I'm here to serve faith-based organizations and recovery support organizations as I'm able to. So here to serve as needed.
Great. Thanks, Eric. Thanks for being here.
I'm Katie Doherty. I'm the services coordinator with the Blount County McNabb Center. I've been here since November, and so just still getting adjusted to a new community and just really invested in how I can fit and serve in that community. And I also have a history as a child and youth therapist, and so I'm very interested in co-occurring disorders and just understanding how we can utilize our experiences in the mental health field and bring that to our community just to raise awareness and just provide support for our youth. So
awesome. Thank you. Who else?
Can you guys hear me?
Yep.
Hey, this is Angeli Schenkel. I am the finance manager at the Blount County Sheriff's Office.
Angeli.
Hey.
Can you all hear me?
Yep.
This is Heather Ledbetter. I'm Maryville City Schools Coordinated School Health Coordinator. I have been involved with Be Aware Blount, formerly known as SAPIT, since 2009, I think. And I have a vested interest in what we can do for our youth in the community to educate so that we can prevent them from becoming drug users, alcohol users, anything that's in those risky health behaviors.
Thanks, Heather. All right, I think we have just a couple more that have hopped on.
Hi, I'll go next. I'm Deb Schuyler. I'm the Family Resource Director with Maryville City Schools and probably have been on it as long as Heather has. But my interest is a lot to do with being trauma informed, and I feel like trauma is the gateway to drug abuse. So I'm very interested in what we're doing to address that and address the needs of our students in Maryville City Schools.
Great, thank you. Okay, I think that might be everybody. If you're coming on late, then you can just hop in and tell us about yourself as we go, but we're gonna go ahead and get started. So welcome to February's meeting. Do you want to talk about that?
Yes. So thank you so much to everyone who participated in our t-shirt fundraiser. We did meet our goal. So those shirts are going to be made and they will be shipped, and they're expected to arrive on February 26th. And so if you selected to have that sent to your house, you can expect it by then. And I believe they should be sending out email updates. And then if you selected to have it sent to us, just email us and we can set up a time for you to come and pick that up. We work out of the Blount County Library now, so hopefully that would be kind of convenient to wherever you might be or if it's not, we can work something out. So we just wanted to say thank you. This was kind of like a test run to see how this whole process would work, and hopefully make it a little bit more fun to kind of raise money and awareness. So thank you.
We'll probably do another one in the summer with short sleeve options, since it is a little bit late in the season. Although with this weather, I guess maybe we don't know, but it's a little late in the season for a long sleeve. So we're going to do one for a short sleeve. And this was really easy. So if your agency is interested in hearing a little bit about how we did this, we would be happy to share it. It was basically no risk at all to us, and a great way to get our message and our branding out into the community to make a little money on the side. So, so thank you for that.
Hey, Amanda and Carly, I got a quick question, because you know when you ordered the t-shirt, there was an option to make an additional donation.
Yes.
If you did that, I think at the same time there was like the angel person who was doubling donations. Did that? Okay, so my question is, if I made an extra donation when I ordered my t-shirt, did that count towards the angel donation, or did I mess that up?
Yes,
Okay,
it did.
good.
So yeah, for all of the sales for our t-shirt fundraiser, that counted in that as well. So for any of you guys that are coming into that, we had an angel donor who just very graciously told us that they would be willing to match all of our donations for a certain period of time for the coalition. And so they did that for us, and our t-shirts were included in that. So basically, you know, if you bought a $30 shirt, it was really $60 that we got from that. All right.
Does anyone else have any other questions about that?
All right, so next week, this is something that we really wanted to be sure to mention. Next week is Quit Week. If you're familiar with the campaign, it's Quitting Time in Tennessee. This is kind of what this week is about. It's a statewide week recognizing the harm of tobacco use, and then providing resources for tobacco and smoking cessation. So of course we know that that also includes vaping, smokeless tobacco, so dip or any tobacco products like that as well. But we're going to be running a social media campaign next week. I believe the mayor's office is going to be involved in helping us out with that as well. We have a proclamation that we're hoping to have done by next week. And this is particularly important for Blount County because we do know that about 20% of Blount County residents smoke cigarettes. And that is higher than the national average. So that's a concern, and that doesn't include youth. So that doesn't include underage smokers that we may not have good data on, or vaping products as well. So this is an important thing. We want to make sure that the whole focus on that is promoting why it's important to not start smoking, but then additionally, if you are smoking, some great resources and some free resources for smoking cessation programs. So please, one thing that you can do in this time of not really holding events or in-person things is share these facts on social media that we're going to be posting. If you're part of agencies and your agency can share any of our social media posts, that of course just broadens our scope of reach and the ability for us to get that information further into our community. So that'll be happening next week from the 21st to the 26th. Does anybody have any questions or thoughts on that? Okie dokie.
I have a question. Sorry, I'm like all chatty today. When y'all did the cleanup in December and you picked up all those cigarette butts, did you take any pictures of that?
Yes.
I think it would be helpful to use some of that when you're doing that social media campaign, just so people see not only is it like that health hazard for those people that are smoking, but there's also this, you know, I just think that would be, you know, anytime you have a picture that kind of is impactful. And obviously if you've collected all those cigarette butts and you have this picture, that would be just a thought.
Yeah. So for any of you that missed it, we had a pickup day in December, and just in Springbrook Park's playground area, we picked up over a pound of cigarettes, which a pound doesn't sound like much, but if you think about how much a cigarette weighs, especially a smoked cigarette, that's actually quite a bit. And so playground areas are supposed to be smoke-free areas, and they're not. That's one of the things that we want to talk with our city government about in terms of signage, and really kind of looking to promote smoke-free areas, especially where kids are concerned in parks and playgrounds. So you can see we have on the slide right here one picture from the pickup day in December, but we also have a lot of other images as well. And we have some interviews from kids that helped us out on that day, just on how surprising it was for them to find that many cigarette butts in areas where little kids play, why they thought it was a problem, just perspective from young kids. So we have some footage from that as well. So that kind of leads into our spring pickup day.
Yes, so we partner with Keep Blount Beautiful for this, and so they're great to work with, and the process is super easy, and we're trying to plan a spring pickup day. And so we were wondering if there are any days that would work best for everyone, or we're trying to avoid spring break just because people might be out of town or whatever that might look like. But we just wanted to reach out and see if anyone had any suggestions about a date or a time.
Anything specifically that isn't good, I guess, is what we're looking at. I was really hoping to do something at the end of March, so that we could have another pickup day in this quarter. And that's something that we can report on and talk about for our next quarter. But are there any specific days that would not be good?
Do you know when? I know when Maryville's spring break is the 15th, and it looks like Alcoa's is the week before, and that week. Do we know when Blount County's is?
I don't off the top of my head yet, but I was going to get those dates today so that we could go ahead and plan something maybe towards the end.
Usually those fall about the same time. So if you wanted to try to get it into March, you could do that last Saturday in March, which is the 26th.
That's a good idea.
And I think that way you would, because most everything tends to be those first couple weeks of March. And that way you get everybody back from spring break and still get it in. Otherwise, you're into April.
Mm-hmm. Potentially warmer too.
Yes. So I mean, one can hope.
It was quite chilly in December when we were out there. The weather did cooperate. I mean, as far as we didn't have any rain or anything, but it was chilly. So, especially with younger kids that want to be involved. So our whole goal here is to have. I mean, we want adults involved in this because. At the end of the day, this is data that we're collecting. So we're collecting data on how much cigarette or tobacco products we're picking up in our parks, and we're able to report back to our local elected officials on that. But the other piece is that we really want youth involved in this as well, because for one thing, it's just a good thing for kids to be involved in something civically minded. But then two, we want to help them see this is yet another reason why it's not a good idea to smoke. Look what it does. Look at the litter that it contributes to. And that's why we've been able to partner with Keep Blount Beautiful, as they're thinking along the same lines, and their mission supports that as well. So we want kids to be involved. We think it's important for kids to be actively involved in service projects, particularly service projects that might deter them from using some sort of substance in the future. So keep an eye out for that. And we would love to have some support with that as well, and potentially a larger turnout than we had in December if we can. Let's talk about this. Okay. So we talked about this in January, but we are starting this month. We are starting our community scans, and this is another piece of data collection for us. So if you've been a part of our process, and some of you guys have for a very long time, then you know that a huge component of our framework that we use for prevention is data collection. And so we are doing this in our community, and we're starting with retailers. So when I say retailers, I mean alcohol and tobacco retailers, anybody that sells alcohol or tobacco products in Blount County. And this is where we need your help. So something that we're doing this year to really target underage sales, which is one of the data points that we had where students were telling us, it's very easy for us to purchase alcohol or tobacco from a store, and we're rarely carded. And so obviously that's a problem for us because that's a first level of intervention, right? Like that's something that should be an easy deterrent, and it's just kind of not happening, or at least that's what our students are reporting to us, is that it's very easy for them to buy from a retailer. They don't have to steal it. They don't have to convince somebody else to get it for them. They're just purchasing it. So in response to that, we are starting these community scans, and it sounds a lot more complicated than it is. Because of COVID, we also decided to scale back some of the in-person aspect of it. But what we're needing from you guys is, in your free time, in your spare time, we need someone that's willing to, or multiple people, we need multiple people that are willing to drive by a retailer on your lunch break, in the morning, after you dropped kids off from school, to school, when you're picking them up, when you're on your way home, any time of the day, it doesn't matter. Drive by a retailer and just see if you can answer these questions. And they're all questions that you can answer from your car. You don't have to get out. You don't have to go in and interact with anybody right now. These are questions. And most of it is about, do they have signage up? Because we know in Tennessee, you have to be 21 now to purchase alcohol or tobacco. So that's something that we could really help. I see Danielle in the chat has said she's willing to do some. We also, do you want to talk about the live form that we have?
Yes. So I basically have just made a survey, and we can have that on our social media and on our website, so it's easily accessible. And so basically it takes less than 5 minutes to just fill it out. And most of these are yes or no questions. And that way all of the data gets sent to us in like a manageable way, and we're not losing like pieces of
Documents.
paper or anything
Yeah.
like that.
Yeah.
So we're trying to make it as simple as possible, just because we know that this is a major need in our county.
Yeah, it's 4 questions that you have to answer. And it's mostly just about what you're observing. You're driving by, you can literally park in the parking lot, and it'll take 10 minutes tops to do. And you're contributing big time to our overall mission and our implementation planning when you do that. But it's not something that staff can do. We can't be eyes and ears. We can help with it, but we can't do it in the ways that you can. And one thing that I would encourage is, if you have kids or if you have youth in your life, go to those retailers in your community, go to the retailers that are right down the street from you and see what you see, because more than likely, if you have kids, that's the first place they're going to go, are those places that are super accessible to them. So we're not trying to structure it so difficultly that it's going to be really hard to organize. You really just pick a place to go, fill this information out. You can pull the live document up on your phone. We'll have a link for it, and you just fill it out from your phone if that's what you want to do. It's pretty easy, but we need your help to do this, because we have a lot of retailers in Blount County, including all the municipalities and all of the area that Blount County encompasses.
And we can provide a list too of all of our retailers, and we can do our best to kind of mark like which ones have been scanned. But I mean, even if someone has already done one location,
multiple scans are fine. Yeah. But to get going, we just want people to do this as they can, for this not to be a super inconvenient thing. Just, in your head, if you pass a place, whether it's a gas station, if it's a liquor store, if it's, where else? A vape store, they should have signage as well.
Or even a grocery store.
A grocery store, they should all have signage. It should be things that you do not have to leave your car to observe. Do we have anyone does anyone have any questions about any of this first? I know if you're coming into this is probably new information. We talked about it last month, but I want to be sure to answer any questions if we have questions about the community checks.
So when would you like us to start the scans?
ASAP. We're gonna put we have the form ready. So we're gonna send the link out today after this meeting. If you have coworkers that you can say like, hey, do you care to just drive by a place, enter the information, we'll get all of that. Okay. Even if you want to do a little initiative wherever you work of, just kind of maintaining that surveillance in our community, because we can't expect our law enforcement to do all of this. They're not able to do regular compliance checks to every single retailer in the county in the way that we would be able to. So as soon as possible, we will post the link for that form, and anytime you go, you just fill it out. And if you're able to do more than once, if you pass multiple places on your way home or on your way to the store, whatever, then that's great too. You just fill out a different form each time.
And the best way to submit that to you, just to email those forms back to you?
It should automatically submit back to us. I haven't personally tested it yet, but we've used this survey site before. So I think you just hit submit and then it sends it straight to us.
It's not going to be a document. It's going to be almost like a page, like a web page, and you'll just fill in those questions. And then when you submit it, the data will come directly to us.
Gotcha. Okay.
So, but we'll post that today, the link for that. And I will also do a test on that just to make sure we don't have any issues. Does anyone else have any questions on this? Because we really want to get this going as quickly as we can and see what kind of feedback that we get from everybody, what everybody's observing. And if all of our signage and our environmental factors are where they need to be in terms of everyone has things posted and whatever like they're supposed to, we can move on to something else. We don't have to belabor this. But we thought this would be an easy place to start. So any other questions or concerns or thoughts on this? Okie dokie.
All right. So our virtual training for parents that we talked about last month has officially been rescheduled for Monday, March 8th. And so that'll be at 6:30. And then, so basically what we're wanting to do is provide virtual trainings for parents to kind of give them the knowledge that they need about different topics such as drug misuse and how to talk to your teens about it. And then they can take that to their own social circles and kind of spread the information from there. And so on March 8th, Kristen Robinson from Acadia, she will be presenting information for us. And so we will have a Zoom link for that. And once I get all of the technical pieces of this setup, I'll send it in like a email so that it's all in one place for you. But we will also have a Facebook Live link. And so this way, at the end of the training, we'll have a live Q&A. So if you or anyone that you know would be interested in that, we can definitely add them to our mailing list. We'll be posting this on our social media. And then if you can't attend this, if you already have something going on, we will be recording it and putting it on YouTube. So there's a lot of different ways to access this information. And we're just trying to make sure that we're providing the materials that are needed to like empower people to be able to recognize the things that might be going on in their own homes.
Mm-hmm. And if you've been involved in this, you've already heard me say this, but our students in our student survey told us that 60% of them haven't had a conversation with a parent or a caregiver about the dangers of prescription drug abuse. And so over half of our kids aren't having any conversations with their parents. And we know that that actually really matters. We know that kids actually really value knowing what their parents think about topics like that, about big life decisions like that. Even when they don't act like it, it still matters to them. And we know that consistent messaging is super important. So having those frequent casual conversations, we mention this all the time, has proven to be the most effective way to really get the point home to your kid. Like, don't use drugs, don't use tobacco, alcohol, whatever message you're trying to instill, right? We need those regular conversations happening. So this is a first training in that. And we really want you to be there if you can be there live, because then you can ask Kristen questions, especially if you have questions about a specific something specific to you, right? So you can ask questions about that. But even if you can't be live and you have to watch it later on YouTube, we are still tracking those impressions. So we'll still be able to see, you know, okay, well, this person participated in this training, and that'll go towards building our capacity as well. So,
And one other thing I wanted to note is that if someone has a question, but they don't particularly want to be associated with that question, feel free to email one of us
Yeah.
and we can ask that anonymously.
Yeah.
So you can still have the answer, but you don't have to like turn on your camera on Zoom or anything. So
yeah, because that can be hard too, especially if you're dealing with something in your own home and you have questions and you want to be anonymous. We can do that for you. So just email them to us ahead of time, and we can do that. Any questions on that or thoughts? I wanted to mention too, any other mental health care providers out there. So maybe even like Helen Ross McNabb, Katie, anyone that could potentially also offer some supplemental community training. We want to partner with you. We have these days semi-professional equipment to do something that is pretty reasonable. We're doing the best that we can, you know, of course, with not really having in-person trainings yet. We're looking to late spring or summer to reevaluate that and kind of see where we are as a community for holding in-person events. But for right now, we want to work with you. If you have, even if you aren't a mental health care provider and you work in the court systems, or you work in law enforcement, or you know, with a civic group, and you feel like you have a topic that parents could really benefit from hearing about, please let us know, because we want to be able to help you push that message out in tandem with our own message. So we would love to partner with you on that.
definitely.
Okie dokie.
All right. So just some housekeeping items. Drug Take Back Day has officially been scheduled for April 24th, which is a Saturday from 10 a.m. to 2 p.m. So you can bring your unwanted, unused, or expired prescription drugs to the Blount County Justice Center, and a police officer will take those from you, no questions asked.
And it's a
So-
drive-through. You don't have to leave your car. You can wear a mask. You can hand off your stuff. So it's pretty low risk.
Yes, and then this way you know that you're not being an accidental drug dealer by throwing them away or anything like that. And they incinerate those, and so it's very safe process from beginning to end.
The other thing I want to mention with that too is statewide, our collections are down. So as you would imagine, since the pandemic began a year ago, statewide collections for drug take back days are pretty significantly down. So my worry and our worry across the state for coalitions is that people are holding on to this stuff in their homes because they're concerned about getting out, which I do understand, but we want to continue to push the message that it does put you at risk to have those medications in your home. So not only you as a potential victim of a crime or whatever, but also other individuals that could be coming into your house that could have access to those drugs that way. So one thing I did want to mention with that too is that we've said this a few times since we've moved to the library and we have our office in the library, but we're actually in the process of moving all of our supplies to the library as well. And we'll be storing them here in the basement. And so for medical lockboxes, we still have those. So if you're needing a medical lockbox, we'll be giving them out on the April 24th take back day. But also if you need one before then, or you know someone that needs one, please let us know and we can get that to you. So that's something easy that we can do that of course cuts down on the risk of diversion that way.
And I saw Danielle asked if we're able to pick them up for people. I don't think at this time we're able to pick up medications. I know
we aren't allowed to touch the medications.
Right.
So at the actual drug take back day, someone through the DEA that has gone through their training has to be the one that handles those medications. So we can't do that yet. I will say other counties, their law enforcement has been willing to do drive-by pickups. So in other counties, we have some police officers that are going out, especially into areas that we know maybe the residents are a little bit older, or they're having problems getting out for whatever reason. And so they're doing pickups that way. That's a big ask of our law enforcement, but that is happening in some of our neighboring counties.
And so lastly, our next meeting will be on March 17th at noon.
Mm-hmm.
Oh, Angela said that she can ask about it.
Oh, great.
That's awesome.
Yeah, I do understand that could be a big ask, but it is something that, especially if you know of high-risk neighborhoods, for whatever reason, any of the reasons that it could be a high-risk neighborhood. I think that would be an awesome way to really get some of those prescription drugs, at least, off the streets and out of our community.
Well,
So
the
would they
other thing is,
I'm sorry. They contact you, Amanda and Carly, about that, or how would that work?
I'm sorry. What was that? One more time?
How would that work as far as the pickup? Who would they notify to come do that? Or
Oh, they could definitely, if you're talking about law enforcement, they could definitely reach out to us, either of us. Yeah.
And
Okay.
Yeah. And I emailed Ryan Rogers yesterday about compliance checks and just kind of what we're doing with that. So yeah, any kind of questions or feedback or anything like that, they can definitely just let us know.
and I was just gonna say, I know sometimes like with the sheriff's department that do like senior wellness checks,
Mm-hmm.
would be another option, because these seniors are going to be in that group that aren't going to come and drive by on a drug take back day, but are going to possibly have unused and expired drugs in their home. So that might be another option if they're already out there doing those wellness checks. That's not an extra, it's an ask of the person that they're checking on, but it's not like an extra trip out if they're already there.
I think that's an awesome idea. So I didn't think about that at all. That seems
I'm on
simple.
fire today. This is it. I've peaked. So I'm done for the day now.
No, you always have good ideas.
You got it. You got it, Amanda. That's it. The United Way's not getting anything today.
Oh my God.
That's a great idea, though.
That really is.
Well, I just
I'll
was thinking
mention that.
because like we work a lot with Meals on Wheels, and I know that that's one of the things that they talk about is that, the sheriff's department has that, it's almost like a specific unit that does like senior wellness checks. And so I'm just thinking like that's a group who's going to have prescriptions, but isn't going to be, they're not going out regardless of a pandemic, but especially during the pandemic. So if they're already there, if they say if you've got expired drugs or drugs that you're done with, why don't you let me take them?
Yeah, that makes a lot of sense to me. I mean, because really, truly what we're talking about too is crime, like reducing crime.
Well, yeah, I mean, these people who have family members who know that they have that particular medication, and that just puts them at risk for somebody coming, to take that too. Yeah.
Mm-hmm. Plus, even like Smiles.
Oh, yeah.
Maybe I should reach out to them, I guess, and see if they'd be willing to incorporate that into their trips, like a drive-by to like the drop box. If they're in town, an appointment, especially like an appointment at the hospital, because the drop box is right across the street.
It's right there. Yep.
Yeah.
There's also a caregiver group in Maryville, and I don't know what their status is with COVID, but I don't know who to reach out to with them. But I know there was like a caregiver support group that we used to meet at Vienna.
Yeah. That's Relative Caregiver Support Group. Kim Starling helps with that. She's my usual contact, and Ed runs the group, and I cannot believe it. I can't think of his last name right now to absolutely save my life.
Is it Ed Harper?
Yes, Ed Harper. He runs the group, and we do meet with them, and they're a great group because I feel like they're always interested in what we have to say or new information. The only thing is the caregivers can take lockboxes from us, but they're not the ones usually with the medications. But yeah, we were going to continue to meet with them and kind of collaborate in that way once they're
You may collaborate with Shaz too, Amanda, the Senior Citizens Home Assistance Services.
Yeah.
Because they've got people that are going out and doing shopping for seniors and doing all of that. So that may be another, even if they can't do it, they may know, how to.
Angelisa and Parks and Rec Senior Center, another great idea, which I hadn't really considered too. Yeah, because here's the thing too, like if we have, so someone through the DEA, which would be our local level DEA, has to actually run a take back event, like a formal take back event. They are technically supposed to be the ones handling the medications and all of that. However, other counties have take back events in different places of the county and at different times of the year if they know there's like a saturation. So for example, Metro Drug out of Knoxville has multiple locations to do take back events, and they're not at the Justice Center, they're throughout the community. So if there's a particular area in Blount County that we're identifying as like, this is really high risk for whatever reason, it is something that they can do. It isn't asked because it's another thing for them to do, but generally there's not a whole lot involved in a take back, especially like a smaller take back like that. So that's a thought too. If, as you're thinking about this, if there was ever a time where it's like, should we do a take back event on another day at the Parks and Rec Senior Center? I don't know.
Mm-hmm.
I can give a little more detail on take back events as far as other counties, because I've been involved with several in other counties. There's always a DEA agent there at every one I've ever been to, and local law enforcement are the ones that normally take the medication. They're the only ones allowed to take the medication. Yeah. But DEA, there's always at least one agent there. So that's why Metro Drug's able to pop them around and do them at Kroger and do them at different places like that. But there's always an agent and there's always law enforcement. Mm-hmm. And usually KPD uses recruits.
Yeah.
Police academy recruits to take those medications back. So
they actually use recruits for our compliance checks here. So, because they're usually under 21. And so that's who they have to try to purchase alcohol. The recruits. They do a good job. I think it's probably very nerve-wracking though. Yeah. So
as far as the signage checks that you talked about earlier, where's that data going to go? Is that data going to go to law enforcement for non-compliance for businesses you find that don't have proper signage?
Yeah, so we're going to share that data with our community partners for sure. So that'll definitely be our local level task force, who traditionally was handling all of our compliance checks, but then that'll actually just go to our retailers. So the big picture plan there is any of our retailers that are consistently having issues, whether it be formally through their FDA compliance checks or their law enforcement compliance checks, or informally through our community scans, we want to offer them training. And so that's kind of the big picture thing. We're not trying to make enemies with our retailers or anyone like that. We're not saying that people that sell alcohol and tobacco are bad. What we're saying is we want to make sure that you have the means and the education and whatever training that you need for your staff to make sure that you're not selling to minors in our community, especially since our minors are telling us this is an access point.
Thank you.
Yeah. Any other thoughts or questions? These are great questions. Danielle did ask, what were our numbers in 2020 compared to 2019? So I don't have the exact number, and I even really hesitate to say this. It was pretty significant though. I want to say that they said it was somewhere between like 200 and 300,000 pounds less this year than last year. And they gave us that information on our last 10-pack meeting just a couple of weeks ago. So I don't have that, but I can definitely, I mean, that can be part of what we send out in terms of like, this is a need, we need to do this. I can tell you locally, we collected probably 300 or 400 pounds less than what we typically do back in October. So, because we usually have a really great turnout for our take back events, especially for our county size.
Well, we didn't have the spring one.
Yeah, and we didn't have the spring one. So we were really kind of thinking in October, we were going to have like a real like bumper crop, if you will, of prescription drugs that were dropped off, but that just wasn't the case. And I know it was still, in the middle of people still being very cautious to get out and things like that. So maybe that was a factor, but given the fact that we hadn't had an event in a year, we were low. So, we want to do better this time. And if you guys have ideas about that, let us know, because we are certainly, as we always say, we are not two people. We're not like a board. This is a community effort, and community change doesn't happen with just two people. So we need everybody. But that's it on our side. Sorry, go ahead.
I had a quick question about that. Sorry. When we're advertising, and just because I'm new to Blount, so I may just have missed this in the past.
Mhm.
Do we reach out to like local pharmacies or people who prescribe medication and kind of let them know about the Take Back Day so they're aware of communicating that with their patients?
Yes. So we actually have one of our DEA reps, and his like additional title is like community outreach as well. So we supply all the printed materials to him, and then he goes to like somewhere around like 80
Doctor's office
pharmacies.
I think every pharmacy in Blount County.
Every pharmacy in Blount County, and I can't remember the exact number of
I think
that.
there's 19.
No, well, I thought he said more than that.
Oh, I'm not sure.
Okay. But he has a comprehensive list. And so he takes printed materials to like posters. And then we also hand out bag stuffers. So for pharmacists, we give them bag stuffers like a month out from Take Back, and they start putting those in pharmacy bags as they're handing those bags out.
Gotcha. Okay.
Yeah. So those are the two things that we do there. But if you have more ideas, we've done different things. We just, not just, but maybe 6 months ago, we acquired a billboard going out towards Townsend, just giving drug drop box information for our county, because Townsend doesn't have one. So they have to bring it into the Justice Center. So we can do advertising like that. And we've actually had some really great outcomes from that too. So like something like 19,000 views a week just from that billboard, because it's on 411. It's a major, highway for us. But we can do things like that with our funding as well. All right. Anything else? Any announcements from agencies? Do you have anything going on that you need us to know about or that you want to announce to the group?
I have one. March 10th is Tennessee Day of Hope by governor proclamation again, and the Tennessee Department of Mental Health and Substance Abuse Services is going to launch a faith recovery resource portal on that day. I'm not sure how much is going to be contained on that portal, but we are going to start filming some local agencies to try to bring awareness to faith-based communities and recovery support communities so we can network people in at a state level. So this can be inter-county, and so you'll know what services are outside the county so we can more properly refer those folks that need assistance. And that's going to be on the 10th.
Okay, thank you. That's awesome.
And I will send more information. I'll send you back more information as I receive from the state. They just informed us of this 3 days ago, actually. So.
Okay, yes,
Great.
please do send that.
Yeah, we'd
our
love
way.
to help promote that. Anybody else? Lisa, do you have any United Way business?
No, we just wrapped up allocations, and so we're kind of in our temporary lull before we start gearing up for events. So yeah, we're just hanging in there.
All right. Well, I think that wraps it up today then, unless there's anything else. We will keep your eyes peeled for those retailer surveys. We will send the link out to that today, and we will try multiple platforms. So that was another thing I meant to say. If you're not getting our notifications through MailChimp, please let us know, and we will make sure that you're added to the list and we have a correct email address and all of that. But we will send that out today on all of our social media platforms and through our newsletter.
Did you say March 8th is the training?
March 5th.
March 8th. It's a Monday.
Yeah.
Yeah. Okay, thanks.
Yeah. All right. And I think that is a wrap. So thank you everyone for being on today. And of course, if you need anything in the interim, please reach out to us. You can give us a call or an email, and we would be happy to work with you.
Awesome.
Thanks, everybody.